topic I want to talk is um, Eliquis versus Alexa or the bigger trend. So I have a similar indication. FDA approved for stroke in non-valvular AFib, uh, venous thromboembolism treatment for prevention. Precaution. The Eliquis should be used in precaution when the creating clearance less than 25 or the serum creatinine over 2.5. Typically, usually low have this level, creating clearance less than 25 or serum creating greater than 2.5. For Badaxa, we should avoid when creating clearance, and it's not recommended to start in patient with creating clearance less than 50. So creating clearance at 60 or above is considered a normal renal function. When it's less than 60, it's not normal. And then when it below, when creating clearance below 50, then we should not start Pradaxa. And this medication contraindicated with patients who have mechanical heart valves, liver disease, active hepatitis, cirrhosis, significant LFT elevation. When people have the AST or LFT um, greater than 2 to 3 um, of yeah, Aliquis or Badaxa. Pregnancy, people who are pregnant, they should be avoided taking this medication, Aliquis, Badaxa. The side effect, Aliquis is better in terms of stomach bleed or GI bleed. Badaxa might increase the GI side effects. So people who have stomach problem like uh, also or uh, the or like that uh, taking Badaxa. Dosing the Aliquid and particular they take 12 hours or twice a day. Uh, for the feeding tube, Badaxa uh, dosage in not be crushed or opened. Uh, capsules may be stored. It must be capsules uh, of the bad acid, but be stored in origin containers. Uh, it, it's only uh, um, good for 3 months to uh, uh, when it's open and it's over 3 months, the medication no longer have efficacy. So open the container with that um, we don't recommend to open that. It have like not up and first or to take from the the, the better with the allergy anti and that's the but that though is either Rusia respite was a but that's uh, allergies but that's generally people with good renal uh, um, why it patient have the increased risk of bleeding have uh, uh, stomach problems like baptist bleeding and renal and event of the uh, be uh, set up and used for the all of the medication. All right, if you have any quick but that's in the comment. Thank you. Today I'm going to talking about the health versus the local driver band. So when it's better, how we do we know um, one of the patients? This medication indication FDA approved for stroke prevention, non-valvular or atrial fibrillation, and the venous thromboembolism treatment or prevention or different thrombosis or DVT or PE. Look at the renal function to choose this medication. The elbow problems in total is in the in patients who have mechanical heart valves, active liver disease like active hepatitis, severe or significant elevation. If the AST or the the AXT over 2 to 3 times their upper limit, then you should not use this medication. People who are pregnant use this medication. Um, the most concern and common so the Aliquid is better than Yeroto uh, for the GI. So people who have concern about stomach bleeding, kind of stomach problems, then we should with the Yeroto. Advantage is twice or twice a year old every 20, but it's no meal. So one advantage of the year old once a day have problem to remember taking the medication, then they might start with Geroto if they don't have any other issue like bleeding risk or kidney problem. For some patients, they need to use the feeding tube, and probably the Aliquid is recommended. These medications, they have similar drug interaction. They should avoid the so CYP3A4 inhibitor and EGB substrate have similar antidote or reversal agent. The Andexanet alpha or Andexa, the brand name. So generally, the Aliquix is recommended more than the Yeroto. Only a few or some patients want one daily dose, then they want to start with the Yeroto. You let me know if you have any question on these two medications. Thank you. I'm talking about the Aliquix versus warfarin. So why you will see some people take Aliquix or Abicipent versus warfarin? So when you go to Google and you just search for it, Aliquix versus warfarin, you will have about 600,000 results. Okay, so for the first few one, you can find some uh, quick information why they choose Aliquid versus Wolfram or vice versa. So the first one from myhealth.net, uh, they say Aliquid is shorter acting than Wolfram. Excuse me. So Aliquid is shorter acting than Wolfram and the blood thinner effect is quicker gain or loss after about 24 hours. Aliquid rarely require bridging because it is shorter acting and can be safely stopped a day or two before any medical procedure or surgery. Yeah, so it's Aliquid's image and the Wolfram image here. So it's not always the case. This is just uh, general information. I've been working for the Anticoagulation clinic for many years. So yes, Eloquix, you have to take one twice a day. Whereas the warfarin or coumadin, you take one tablet, one dose a day. So it have a longer half-life and it take a longer time to get to the peak effect and get into stable state. So usually warfarin take 3 to 5 days to start working in your body when you just start warfarin. And then it take 1 to 2 weeks to get to the peak, like the peak. And then uh, it become a stable state after 2 weeks or so. Adequate is just similar to the low enough injection or enough suffering injection. So adequate is the fifth dose medication. Either take 5 milligrams twice a day or 2.5 milligrams twice a day for certain patients. So it work every 12 hours medication. You should take same time every day, every 12 hours, and then the warfarin the same time every, every 24 hours. Uh, Eliquis is very expensive medication compared to warfarin. Eliquis, even though you have copay, it is very expensive, like, $500 per month and about 1,000 or more for 90-day supply. Warfarin is like, $10 for 3 months or so it's very cheap. Eliquis is a new medication. I think it's available since 2018 or so, or 2017 until now. It's been studied and it showed that the Eliquis is effective just like warfarin. And for elderly people, it may be convenient. They don't, have to go with the confused dosage with warfarin. Aliquid just take one tablet, fixed dose twice a day. So it may be best for a lot of patients, especially elderly people. Um, Warfarin is very complicated in dosing. Someday you take one tablet, someday you need to take half tablet. It's a weekly dose, but you have to take every day. It sounds very complicated. Another advantage of Eliquid is diet. Warfarin might be affected by the vitamin K foods like greens, vegetables like kale, cucumbers, spinach, broccoli, things like that might affect warfarin. If you eat more vitamin K food, it may make the iron level go down. And if you eat less vegetable, it makes the iron level go up. So you must be stable with vitamin K foods every day. Eloquence is not affected by vitamin K foods. So, most of people happy with that. They don't have to watch for their diet. And another advantage of Eliquis compared to warfarin, Eliquis doesn't require close monitoring. Okay, some people, if you are over 75 and, and you have normal kidney function, normal liver function, you only required to test your blood, every 6 months. Uh, and then for warfarin, you had the maximum they can extend the follow-up is 6 weeks. Okay, so 6 weeks you need to come back to get the iron test, your blood test, to make sure your warfarin level is not too high or not too low. When the iron too low, it means you don't have enough warfarin in your body. When iron too high, it means you have too much warfarin in your body. It's make heart bleeding. So that's why they have to test your iron level frequently. If you are stable, your iron very stable, then you can come back in 6 weeks. But if your iron level is not stable, you have to come back frequently, like weekly or 2 weeks or 3 weeks, depending on your iron level. If your iron level is critical, it means it's too high, like 5.0 or 6, then you might need to hold over and come back in 3 days or 2 days, things like that. But an adequate is not frequent follow-up or test. No test required to make sure the element is enough in the body. No, we don't have that test. That test is very expensive and it's no required. For the side effect, somehow, and then for elderly patient, Eliquis may be better than warfarin because they don't confuse. They are not confused with the dosage. So if they take the Eliquis with the instructed dose, then they have no problem with the bleeding. But for warfarin, sometimes they confuse with the dose, and then they may take a wrong dose, and it will cause bleeding. That's one reason. The second, based on the study, Eliquis may be better in terms of solid bleeding compared to warfarin for the elderly patient. And then the Eliquis Uh, it's just like low enough injection, so you don't have to be breached before the surgery because you may only need to hold for 2 days prior to the major surgery or procedure. And on the kidney function, if you had a bad kidney function, then uh, more than 2 days, like 3 or 4 days, depend on your kidney function, you know. And the the allergists, they only need to monitor the side effect, which is they need to bleeding. So they need to test your complete blood count to make sure the hemoglobin is not too low. If the hemoglobin too low, it's been you might have some kind of internal bleeding. Then you need to pay attention on allergies, and then you need to go to see a doctor, the stomach doctor, to make sure it's not caused by the allergies. And then, uh, you need to check your, right, when you're on blood thinner medication, you need to check your stool and your urine frequently to make sure any kind of bleeding. Check your skin to see if any abnormal bruising, those things that you need to pay attention, and you need to avoid any physical activity that easily cause fall. So those things need to be careful when you're on any kind of blood thinner medication. So, eloquence generally is maybe better than warfarin in terms of side effect, and then it's more convenient than warfarin because the dose is a fixed dose and they're not required to um, test frequently, and they're not and the diet, vegetables, greens, uh, do not affect eloquence. So more convenient, and it might be better in terms of side effect for some people. The disadvantage is it's so expensive. Some insurance, some healthcare insurer, they don't pay for it. So you need to work out with your health insurance to make sure they cover. And if somebody worry about their therapeutic or their how the allergies work in their body, how do they want to know, if enough allergies in the body or not. So if for some people like that, they might stick with warfarin. They don't want to try the medication you know, if not, uh, if they not need the blood test to make sure it's not too low or too high, like warfarin. And some people need to take Eliquid with a lower dose, like 2.5 milligrams twice a day. No, no people because they over 80 years old and their weight is under 132 pounds, things like that. If they have those two factors, then they require to take a lower dose. If their kidney function, if their creatinine lesser than greater than 2.5, then probably they need to take a lower dose. For certain people, like people on dialysis, they may be not the best candidate for the allergies. They should stick with warfarin. So, if you have any further question or concern about if you are taking any platinum medication, then please let me know in the comment below. How to
to switch from Eroto to warfarin. You can go to Google again and type in switching from Eroto to warfarin. You have about 45,000 or 45,000 results. So that's a lot, but for the first few um, results, and learn uh, how to speak to uh, women from Europa. So they recommend that um, you need to continue Yeroto and Wolfen. You start Wolfen and continue the Yeroto together, overlap for 3 days. So you stop the Yeroto uh, in 3 days. Switching from Yeroto to Wolfen. Okay. So you start Wolfen and then Yeroto, and then stop the Yeroto in 3 days. Okay. So hopefully in 3 days, Wolfen start working. Okay. But if the in 3 days, you detect the I9 level is still too low, like 1.2, 1.3, 1.4, and I would continue Yeroto for 1 or 2 more days and increase the wolfing a little bit to make sure the patient is safe from blood clot. I should to tell the patient to remember to stop Yeroto um, as instructed. Some patient they forgot to stop the Yeroto. So that's the main thing. The patient, you might call the patient, um, make sure they stop the Yeroto as instructed. Otherwise, may cause bleeding. So usually for the new warming start, you check the iron level maybe twice a week, Monday and then the next time Thursday or Friday. So I would recommend that you should, uh, you know, start warfarin and then stop the Geroto in 3 days. Um, and then recheck the iron. If the iron is still too low, then I would recommend continue for another 1 or 2 days. And then adjust the weapon dose to make sure it's not too high and not too low. And then recheck in about 3 days to make sure um, the patient is not at risk of blood clot or stroke. And then to make sure the patient is not continue taking both medication, the Yeroto and Woven. Okay. So if the iron is still very low and probably need to increase the warfarin to make sure to get to the therapeutic level. And have the patient to report any abnormal bruising or increased bleeding risk. Thank you. How to switch from warfarin to Badax? Go to Google and type in switching from warfarin to Badaxa. You have about 340,000 results. The first few top results, we may have some information. Here, pharmacist.com give you a very quick information. So you start warfarin and start Adaxa when INR less than 2. So this is a general recommendation that how you apply if you are from the hospital setting. If you work in the hospital, you might check INR daily. So when is INR less than 2, then you start Badaxa on the same schedule, start the work. And Badaxa is twice a day doses. You take one capsule twice a day. How about the outpatient setting? Um, if you check the INR and INR is uh, less than 2, and the patient at the outpatient clinic, and you are able to give the patient the medication, the Badaxa, then the patient can start Badaxa at the schedule of warfarin. You start warfarin and start Badaxa. But when I'm at the therapeutic level, like between 2 and 3, so um, you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days to make sure I'm less than for the patient the Alexa. But if the patient need to, if you need to send the medication to the patient home, if you overnight, it may take one day. And then if the INA is at the therapeutic level, then I need for 1 or 2 days, make sure INA less for the patient to take it. If the INA at the time of visit is like 3 point above the level, 3.1 to 5, then probably the patient needs to hold more than 2 days, like maybe 3 days. And how about if the I9, above 3.6 or so, then probably the patient needs to beg to reject I9, just hold a half dose or 1 dose to make sure that I9 back to the normal range and then recheck it for the notice or for the instruction. It depends on the I9 level and inpatient or outpatient status to provide best recommendation when doing switch from open to exit. How to switch from production to open, or switch from a bigger trend to open. So go to go, and I've been switching from production to open. You have about 400,000 doses. Again, when you look at the first few top websites, right here, start offering and start a bigger trend when I'm less than lower limit of therapeutic brand, usually less than 2. Pharmacist.com recommend stop offering and start a bigger trend when I'm not. So, in the hospital setting, you can do daily INR. So you check the INR, it's less than 2, then just stop, open, and start the bigger trend. But how about the outpatient setting? At the time of business, when INR less than 2, then probably you can hold the bigger trend 1 day and then start the Alexa, if the patient has the medication um, on hand, then you may, when I know less than 2, stop warfarin and start the Alexa. If the patient um, doesn't have the Alexa on hand, like you need to overnight the medication, things like that, it may take 1 day or so um, to get to the patient home. So you need to, um, if the iron at the therapeutic level, then you just hold the bigger pen for 1 day or 2 days prior to the dioxide. If the iron now like 3.2, 3.1 to 3.5, then I would hold open for like 3 days or so to make sure that I'm not less than 2, then the dioxide. But if it's greater than 3.6, I would hold the warfarin for 1 day and have the patient come back in 1 week to recheck the I-90 for further instruction. So it depends on the I-90 level in order to recommend when, how many days need to hold the warfarin in order to get the I-90 switching adapt. All right, so how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. You can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay? And for the first few ones, there's some information that tell you how to speak to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start Xarelto when I less than 3. You know that for the Eliquix or Vedex, when less than 2, but for Xarelto it's than 3. Why? Why it's different? Because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, the medication lasts longer. And then it take longer time to get to the peak effect. So, when the iron is less than 3, so you stop the warfarin and start Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the iron less than 3 instead of less than. So, and then similar to Eliquis, if the patient had the life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, like luminol injection. So, I mean, when you want to switch from Xarelto to warfarin, and then you might need to consider the luminol injection to make sure the patient don't have any stroke risk or any life-threatening blood clot. But when you switch from warfarin to Xarelto, then you only need to know when the iron is less than 3. And, but it's different from the hospital libation and the outpatient patient. So for in the hospital, you may monitor iron now or recheck iron maybe daily basis to make sure iron less than 3 before you start the therapy. But how about the outpatient setting? You don't do the iron daily basis. How do you plan for that? Uh, for me, when the iron, for example, at the uh, therapeutic iron, then yeah, I just tell the patient to stop the warfarin, and I overnight the yellow toe, or I send the patient to the pharmacy window so they can pick up the Yeroto and start the Yeroto next day, the same schedule they are taking warfarin. So when I know the iodine therapeutic, then it's between 2 and 3, then I'll say go ahead and start the warfarin for tonight and start the Yeroto tomorrow. And I know the patient will receive the medication at window, or will have the patient tomorrow via the overnight service. And how about if the iron are too low? If it's too low, then I would just say take half the warfarin at their schedule, and then start the Yeroto the next day at the same schedule of warfarin. What happens if the iron are too high? Like 3.5 or 3.5 or 4 or or about 3. So if it is about if the INA about 3.2, then I would just say stop the warfarin for 1 day, and then and go ahead and take Yeroto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, and then stop the Yeroto for 2 to 3 days. But if it's more than 4, then I will have to hold the dose and I have the patient to come back, in 1 week and to retest the iron and go from there. But I don't. If it's above 4, and I have to have the patient to recheck the iron. That's how I switch from warfarin to Yeroto. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You find about more than 300,000 results from this search. But the top fuels website have some very important information for you. The first one, say converting the Eliquis or this event. They recommend start warfarin and stop this event 3 days later. So this is correct, but this depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay? And the normal warfarin is usually below 0.9 or 0.9. So around that level is no warfarin. The people never are warfarin before. But how about if the warfarin level at that time at the baseline very high, like 0.2, meaning 1.2 or 1.3, things like that. And you may need to stop abicipline maybe days or so. And then the second option, they say maybe stop abicipline and then start the parenteral anticoagulant or the injection anticoagulant. So, like Lovenox, and then warfarin at the same time. So, for some people, they are very uh, high risk of a stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you might, if you want to switch to warfarin, then you probably need to make sure warfarin at a therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to into the therapeutic level. In order to make sure that you need to have some form of injection, like local injection, to make sure the patient is not risk of having stroke or dangerous blood clot. So that's about what you need to know when you uh, switching from aliquot to warfarin. But you need to make sure you have the baseline iodine, and then based on the iodine level, you may need to to make sure when it's safe to stop the aliquots. Maybe 3 days later, if you have normal baseline iodine. If you have high baseline iodine, then you might need to consider to stop the aliquots a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low-venom injection, make sure the iodine level at therapeutic before you stop the low-venom injection. Make sure the patient not having stroke or dangerous blood clot, like blood clot in their lungs. Thank you. How to switch from Aliquid to warfarin? You can go to Google and type switching from Aliquid to warfarin. You can find about 300,000 results for last search. Look at the first few results. The first result is telling you right here, say, converting Aliquid or abicipline. So they recommend start warfarin and stop abicipline 3 days later. So basically, it depends on the warfarin level. For example, if INA at the therapeutic level, yes, then you may stop. I'm sorry. If the INA as the baseline is normal, I mean, usually the normal INA is less than 0.9 or so. Is the people who never take the warfarin before. So you basically just start warfarin and stop abicipline 3 days later. But how about if the iron is higher than the normal level as the baseline? So you need to properly, uh, you know, start the warfarin and stop the adrenaline maybe 2 days later to be safe for the bleeding risk. It's also say that uh, if you need to make sure, for example, if the patient is very high risk of the blood clot, like acute blood clot, they just have the blood clot in their lung, and the blood clot is very critical, dangerous to the patient. The patient should not uh, be the INR should not be low, or the patient need to have certain anticoagulant in their body. So for that case, then the patient might need to take the warfarin and the uh, uh, injection, like Lovenox injection. So for that case, yeah, you need to stop the Eliquix um, and then stop the and start the warfarin and the Lovenox together. So start warfarin and Lovenox together from day one for maybe 5 days or more, and then check the INA to make sure the INA levels is at therapeutic, between 2 and 3 or so, and then uh, stop the lobanal injection and to continue to take a warfarin alone. So that's the case that you need to make sure that you um, how to switch from warfarin to Eliquix. So you can go to Google and type in switching from warfarin to Eliquix or Adixaban. So you can find uh, about 400,000 results. Okay, but the first few uh, websites help you to understanding how to switch from warfarin to Eliquix or other direct acting oral anticoagulations. So for Eliquix, we'll switch to the Eliquix when the iron are less than 2. So, excuse me. So, for example, if the patient iron is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin um, about 2 days prior to starting the Eliquix. So, at that time, I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquix from warfarin. So again, it depends on the iodine level, so we can have the patient switch from warfarin to Eliquis from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the iron to make sure it's less than 2 before start taking the Eliquis. It's most easier um, for the patient to switch to the Eliquis when they're still at the hospital. But if the outpatient management, then you need to like stop the warfarin for 2 days. If the iron at the therapeutic level, um, and then start the Eliquis to make sure the iron less than 2. If the iron a little bit high, like 3.2 or 3.3, then I would go with recommend to stop the warfarin for 3 days prior to uh, uh, starting Eliquis. But what happens if the iron at the really high, like 3.6 or above in the time visit, then I would recommend I would reduce the dose or take a partial dose and then retest INR in 1 week to make sure INR level uh, therapeutic before switching to the Eliquis. And when the INR at the therapeutic level, then just try to hold 1 or 2 days prior to the Eliquis, prior to starting the Eliquis to make sure the INR is. The COVID-19 caused VTE, the thromboembolism, venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to, you can type COVID-19 cause VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. And then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience decoagulation disorder. And then in the following website, Boston Medical with the COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced some patients vaccine and they experience the increase of the INA. So the COVID-19 vaccines might increase the INA number. It's not much. It's about 0.5 to 1. For example, people who normally have iron around 2.5, they may increase the iron to 3.0 to 3.5 after vaccination. So, but it not last long. Usually they experience the iron increase in about 3 to 4 weeks. And after that, they back to the normal target, normal range. So in those 3 to 4 weeks, the patient who have increased the iron, the COVID-19 vaccines, are used to decrease the warfarin dose a little bit, like maybe just a half dose per week to make sure that I'm not outrange, it's not super therapeutic. So, so yes, some people have a concern whether or not the COVID-19 vaccine affect the iron level or not. Yes, they
Avoid production or the bigger trend. If you are allergic to production, you should avoid production for some indication, such as anti-phospholipid antibody syndrome or mechanical heart failure. You should avoid production if you are taking rifampin, St. John's wort, because this medication may reduce your Badaxa effect. You should avoid Badaxa if you are taking verapamil, quinidine, azithromycin, clarithromycin, erythromycin, itraconazole, ketoconazole. This medication may increase your Badaxa effect. You should check with your pharmacist or your doctor if you are taking any new medication or over the counter when you taking Badaxa. Some over the counter like Motrin or aspirin might increase risk of bleeding when you take with Badaxa. So make sure you let your doctor or your pharmacist you should avoid Badaxa if you have major and with Badaxa. Use Badaxa for to take warfarin or Lovenox instead. You should check with your doctor who manages your blood thinner medication or the anticoagulation clinic for further instruction. Please let me know if you have any questions in the comment box below. Thank you. Avoid Eroto or rivaroxaban if you are allergic to Eroto. You should not use Eroto for some indication such as anti-phospholipid antibody syndrome or mechanical heart failure. You should avoid Eroto if you are taking rifampin, rifadin, carbamazepine, phenytoin, because this medication may reduce your Eroto effect. You should avoid Geroto if you are taking ketoconazole, isoconazole, ritonavir, because this medication may increase Geroto effect. You should check with your pharmacist or your doctor for any other medication to make sure there is no drug interactions between Geroto and prescribed medication or over the counter, such as Motrin or aspirin. You should avoid Geroto if you are having major and ongoing bleeding with Geroto. You should not use Geroto if you have blood clots due to active cancer. This is just for your general information. You should check with your doctor or your pharmacist if you have any further questions. Please let me know if you have any question in the comment box below. Thank you. Avoid Eliquis or Abiciban if you are allergic to Eliquis. You should not use Eliquis for indications such as for indication like antiphospholipid antibody syndrome or mechanical heart valve. You should not take Eliquis if you are taking rifampin, carbamazepine, phenytoin, because these medications may reduce the Eliquis effect. You should avoid Eliquis if you are taking ketoconazole, isoconazole, ritonavir, because this medication may increase the Eliquis effect. If you have to take ketoconazole, isoconazole, or ritonavir, you may have to reduce the Eliquis. You should avoid Eliquis if you have major and ongoing bleeding with the Eliquis. You should not take the Eliquis if you for the blood clots due to active cancer. Generally, if you have active cancer, you may try warfarin or diclofenac instead. This is just for your general information. You should check with your doctor who manages your blood thinner medication, your anticoagulant for further instruction. If you have any question, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. The opioid effect, it gives you a good feeling like high, so to continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine, other non-opioid drugs such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioids, including OxyContin or oxycodone, fentanyl, methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue lawsuits to the manufacturer, Voodoo Pharma. A lot of people will die because of the OxyContin long extended relief effects overdose. The manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. So when the OxyContin supply has problems, the drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the OxyContin abuse, addiction, dependence, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid illegal drugs such as marijuana, methaqualone. Marijuana may be legal in some states, and the prescription opioids including OxyContin or oxycodone. Fentanyl. Fentanyl is a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids including OxyContin, fentanyl, due to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or oxycontin addiction or dependence, they start using the fentanyl. Maybe more convenient and it might be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligram or 2000 microgram. Many tablets or pills from these illegal migrants found more than 2 milligram. So one tablet contains more than 2 milligram. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. The opioid effect, they give you a good feeling, like high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdose. When people get overdose, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. If you have any further questions, please let me know in the comment box below. Thank you. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal for the medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin is the brand name for the oxycodone. It is extended release, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease may be an arthritis. For example, arthritis is a disease that may cause a pain symptom such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, Diuretic, Soma, before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. The opioid abuse might lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. The opioid effect or the oxycontin effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdose. When people get overdose, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing to avoid OxyContin addiction, you should take OxyContin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You may use non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with the AFib, then you may be on a platinum medication indefinitely for the rest of your life, unless your cardiologist can convert your heart back to normal. That's very rare. Sometimes people have AFib, but they don't start the platinum medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the blood thinner medication yet. They may put you on baby aspirin. So when you have a AFib, your doctor need to select one of the oral blood thinner medication. If your AFib is not regular, you may start with the Eliquis, Xarelto, or Badaxa for your convenience. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, then your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or abicipar, Xarelto, rivaroxaban, Adaxa, dabigatran. Protein C or protein S deficiency treatment duration. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or abicipar, Xarelto, rivaroxaban, Adaxa, dabigatran. So for this medication, I think there are ongoing studies. Antithrombin or AT deficiency treatment duration. The blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor V latent deficiency. The first one is homozygous factor V latent deficiency. This is my single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you may need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous This is the major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take a blood thinner medication indefinitely, regardless of having a blood clot in the past. The best medication for this indication is warfarin. There are ongoing studies for the other medications such as Alaquip, Geroto, Adaxa for this indication. If you have any further question, please let me know in the comment box below. Thank you. Antiphospholipid antibody syndrome, AAS, or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Alaquip, Geroto, Adaxa. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic mitral valve disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take the blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot in your lung or the cause of the blood clot, you may only need to take a blood thinner medication for about 3 to 6 months if that is the first time you have a blood clot in your lung. If you don't know the cause, don't know why you have a blood clot in your lung, and if that is the first time you have a blood clot in your lung, you take blood thinner medication for 6 to 12 months. If you have a second time blood clot in your lung, current blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that consider recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication longer, maybe for the rest of your life, or definitely. And finally, if you have a blood clot in your lung and it's related to an active cancer, then you may need to take a blood thinner medication until you no longer have cancer and at least for 3 to 6 months. So you have to take a blood thinner medication at least for 3 to 6 months and until you no longer have active cancer. If you have any further question about this, please let me know in the comment box below. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So how long you have to be on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? You have to take a blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life, if you don't know what is the cause of the blood clot in your leg, then you might need to take 6 to 12 months if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is a general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. Mitral heart valve treatment duration. If you have mechanical mitral heart valve, you may need to take a blood thinner medication for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you may only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is a general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment, therapy, and duration. If you have any further question, please let me know in the comment box below. Thank you. Transient ischemic attack, TIA, or mini stroke treatment duration. So the duration, it could be clinical adjustment. So it depends. After the TAA, you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further question, please let me know in the comment box below. Thank you. Aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a platinum medication indefinitely for the rest of your life. The best medication is warfarin. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you might need to take a platinum medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a platinum medication. If you have aortic heart valve, your cardiologist will tell you exactly how long you have to be on a platinum medication or an aspirin. If you have any further question, please let me know in the comment box below. Thank you. Stroke and platinum medication treatment duration. So if you have a stroke and you have to take a platinum medication, you know how long you have to be on a platinum medication. If you know your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take a platinum medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a platinum medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a platinum medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV thrombus, you may need to take a platinum medication for at least 3 months. The best medication, the best platinum medication is warfarin. So if you have a history of dilated cardiomyopathy, and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a platinum medication indefinitely or for the rest of your life. If you have a history of dilated cardiomyopathy, and now you have a left ventricular thrombus, then you may need to take a blood thinner medication for at least 3 months. The best blood thinner medication is warfarin. You should follow your cardiologist's instructions for treatment, therapy, and duration. If you have any further questions, please let me know in the comment box below. Thank you. Bye. Prior to pacemaker or defibrillator placement, what should you do if you are taking warfarin, Aliquid, Geroto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. However, you should recheck your INR prior to the procedure. Make sure your INR is therapeutic. If your INR is elevated or critical, then make sure you follow your doctor who manage your warfarin or the anticoagulation to hold your warfarin or adjust your warfarin dose to make sure it is therapeutic or at the goal level before the procedure. If you are taking Aliquid, Geroto, or Badaxa, you should check your kidney function to make sure you don't have any bleeding complication from the procedure. You should continue to take the Aliquid, Geroto, or Badaxa, otherwise as indicated, instructed by your surgeon or proceduralist. If you have any question or concern for me, please let me know in the comment box below. Thank you. Prior to pacemaker or defibrillator battery change, what should you do if you are taking platinum medication such as warfarin, Aliquid, Geroto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. If your warfarin is therapeutic, if your INR is elevated or critical, then you should recheck your INR prior to the procedure. It's best if your INR is therapeutic before the procedure. If you are taking Aliquid, Geroto, or Badaxa, you should check your kidney function. You do not hold unless otherwise as indicated. You should follow your surgeon or proceduralist instruction. If you have any further question or concern before this procedure, please let me know in the comment box below. Thank you. What should you do prior to lung biopsy procedure if you are taking a blood thinner medication such as warfarin, Aliquid, Geroto, or Badaxa? If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic and you are stable with your warfarin, like you have a stable INR history, then you should hold your warfarin for 4 to 5 days prior to the procedure. If you have a critical INR like over 5, then you may need to hold your warfarin and then reduce your warfarin dose and recheck your INR in about 1 week prior to a procedure. If you have to hold your warfarin for more than 3 days, you should bridge with a luminal injection to prevent from recurrent blood clot or stroke. You should follow your doctor or the anticoagulation or bridging instruction. If you have to take the Aliquid, Geroto, or Badaxa, you may need to check your kidney function. If your kidney function is normal or creatinine clearance greater than 50, then you might only need to hold Aliquid, Geroto, or Badaxa for 2 days. If your kidney function is not normal when your creatinine clearance less than 50, then you may need to hold your Xarelto or Badaxa for more than 2 days. When you hold for more than 2 days, then you may need to delay to resume your Eliquis, Xarelto or Badaxa. You should follow your surgeon or procedure list to resume your blood thinner medication. Any question, you should check with your doctor who managed your blood thinner medication or your anti-coag clinic. If you have any question for me, please let me know in the comment box below. Thank you. Right, to learn removal procedure, what should you do if you are taking blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is therapeutic and your INR history is stable, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is critical or elevated, your doctor who manages your warfarin or your anti-coag clinic may need to hold your warfarin or reduce your warfarin dose and recheck your INR in about 1 week to make sure your INR is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, then you may need to be rich with your low injections to prevent from having recurrent blood clot or stroke. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. If the creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, Badaxa for more than 2 days prior to the procedure. If creatinine clearance greater than 50, then you only need to hold your Eliquis, Xarelto, or Badaxa for 2 days prior to the procedure. You may need to delay to resume if you hold for more than 3 days. You need to follow your doctor or the anti-coag clinic instruction. You should resume your blood thinner medication as instructed by your surgeon or procedure list. If you have any further question, please let me know in the comment box below. Thank you. Spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Xarelto or Badaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4-5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve get back to the therapeutic level, then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to reach with the Lovenol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor 5 deficiency. If you are taking the Lovenol injection to bridge when you off warfarin, you need to follow your doctor who manage your warfarin or the anticoagulation instruction closely. Make sure you understand when you need to start the Lovenol injection, when you need to stop the Lovenol injection before the surgery, when you need to resume after the surgery, and when you need to completely stop the Lovenol injection therapy. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney labs to make sure they are up to date. If they are more than 3 months old, then need to update the labs. Or those people who have kidney problems, such as kidney failures or chronic kidney disease, they should um, get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manage your warfarin or your anticoagulant. If you have any further question, please let me know in the comment box below. Thank you. Liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then you should hold your warfarin 4 to 5 days prior to the procedure. If the INR result is slightly elevated, then you should adjust your warfarin dose a little bit and hold 4 to 5 days prior to the procedure. If you have very elevated INR or critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, return to therapeutic range. before you can plan procedure. So you should follow your doctor who manage your warfarin or anticoagulant closely. Make sure you have a appropriate plan for surgery. Anytime you have to hold your warfarin more than 3 days, I would recommend that you should consider reaching with the Lovenox injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, such as uh, factor 5 deficiency or some kind of genetic risk. If you have to reach with the Lovenox injection, you need to follow your doctor or the anti-war clinic closely to make sure you understand when you need to start overnight injection, when to stop the overnight injection for the surgery, and when to resume your overnight injection after the procedure, when completely stop the overnight injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date within 3 months. If you have kidney problems such as kidney failures or kidney disease, then you need more update labs than the normal people. If your kidney labs within normal limits, then you should hold for 2 days. If the creatinine clearance not within normal limit, for example, if less than 50, then you may need to hold more than 2 days. You should resume your Eliquis, Xarelto, or Badaxa the day after the procedure if your kidney function is normal. You should delay resuming your Eliquis, Xarelto, Badaxa if your kidney function is not normal. You may resume 2 to 3 days after the procedure. You should also check with your surgeon or proceduralist. Make sure you are safe to resume your blood thinner medication. If any difference, you need to talk to your doctor who manage your blood thinner medication or your anticoagulant. If you have any question, concern, please let me know in the comment box below. Thank you. Liver biopsy. What to do prior to liver biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve, even your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manage your warfarin or the anticoagulation closely to you have a good plan for your procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lobanol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take the lobanol injection, you need to follow your doctor who manage your warfarin or the anticoag instructions closely. Make sure you understand when you need to start the lobanol injection, when you need to stop the lobanol injection right before the procedure, when you need to resume your lobanol injection after the procedure, when you need to completely stop the lobanol injection therapy. If you are taking Eliquis or Yerotol or Badaxa, you should check your kidney labs to make sure your kidney function is normal. If your kidney labs are more than 3 months old, then you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you might need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa more than 3 days. And you may need to resume about 2 to 3 days after the procedure. Uh, if your kidney function is normal, you can resume your Eliquis, Xarelto, Badaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume your blood thinner medication. If any different, you should let your doctor who manage your warfarin or blood thinner medication or the anticoagulation so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other blood thinner medication, please let me know in the comment box below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a blood thinner medication, such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, I would recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, I need to fix your INR, come back in 1 week to see if it improve and plan for the procedure. If you are in a critical, you need to hold warfarin, reduce the dose, and come back in 1 week. Check your INR, plan for the procedure. Anytime you hold your warfarin more than 2 days, you will consider reaching with the lobe injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobe injection, you should follow your doctor who manages your warfarin or the anticoagulation instruction closely to understand when you need to start the lobe injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the lobe injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you may need to repeat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you may need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum medication. If any different, you should check from doctor who manage your platinum medication for the anticoagulation. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold your warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then you may need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hope for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range, or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider reaching with the luminal injection if you have a recurrent blood clot or stroke history and you have strong risk factor of having blood clot or stroke, then need to treat with luminal injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the lobe and bridging. You should follow the instruction closely to understand when you need to start the lobe injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the lobe injection quickly. If you are taking the Eliquis, Yeroto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you may need to hold more than 2 days. And you may need to delay resuming your Eliquis, Yeroto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum medication after the procedure. If anything different, I need to discuss with your doctor who manage for platinum medication or anticoagulant. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Geroto, Badaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose, then come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved or you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan to bridge with a lower nerve injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to bridge with the lower nerve injection, you should follow the instruction from your doctor who manage your warfarin or the anticoagulant to make sure you understand when to start the lower nerve injection, when you need to stop for the procedure, when you should resume your lower nerve injection. If you are taking the Eliquis, Xarelto, or Badaxa, you might need to check your kidney function to make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need hold your Eliquis, Xarelto, or Badaxa more than 2 days. If you have normal kidney function, then you may need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who manages your platinum medication or your anticoagulant should give you a complete instruction when to, to start, uh, when to hold your Eliquis, Xarelto, Badaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manage your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to procedure. If you have stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR, come back in 1 week to see if your INR improve or you can plan for the surgery. If you have a critical INR result, then probably you need to hold your INR and use the dose. Come back in 1 week. Make sure your INR improve so you can plan for it. You have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, then you need to be breached with a low enough injection. Your doctor who manage your platinum medication, warfarin, the anticoagulation, will give you the separate instruction. Make sure you understand when you should start the low injection, when you need to stop right before procedure, when you need to resume after the you should follow the instruction closely. If you are taking Eliquis, Yeroto, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date labs that require. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you may resume 1 day, 2 or 3 days, depend on your kidney. You must also check with your surgeon or proceduralist to see it's okay for you to look your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulation. If it is different recommendation, then you need to discuss with, excuse me, with your doctor who managed your platinum medication. If you have any further questions, please let me know. Comment box below. Thank you. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking a platinum such as warfarin, Eliquis, Yeroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you may need to hold 4 to 5 days prior to the procedure. If your INR result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for the procedure. You may need to come back in 1 week to see if your INR improved, or you can plan for the procedure. And if your INR improved, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a low-vein injection if you have a history of recurrent blood clot, uh, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to proceed with the low-vein injection, it should give you a separate instruction when you need to start your low-vein, when you stop before the procedure, when you when you should resume your lower nose after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. So your doctors who manage your Eliquis, Xarelto, or Badaxa, or the anticoagulation will give you the complete instruction when you need to hold Eliquis, Xarelto, or Badaxa, when to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Adaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR as the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manage your warfarin or anticoagulation, they will instruct you how to start your Lovenox injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin or the anticoagulant. If you are taking the Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Badaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. Your doctor who manage your blood thinner medication or your anticoagulant will give you complete instruction when to stop and to resume Eliquis, Xarelto, or Badaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your blood thinner medication, you need to discuss that with your doctor, manage your blood thinner medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure, what should you do prior to ablation procedure if you are taking blood thinner medication or when you're taking blood thinner medication? Do not hold your blood thinner medication unless otherwise as instructed. For warfarin, you should test your INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly, 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR not therapeutic, then you may need to restart the cycle. If you take Eliquis, Xarelto, or Daxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, you should report to the proceduralist or the anticoagulant. Cardioversion, what to do prior to cardioversion procedure if you are taking blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. Typically, you must be on blood thinner medication before they can the cardioversion procedure. And sorry, do not hold your blood thinner medication prior and after cardioversion. You must test your, if you take in warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If you are not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, you are not supposed to be therapeutic. If not, if you are not too low, they may need to reach you with a Lebanon injection. For the Aliquid, Yeroto, or Badaxa, you have to continue taking this medication. If you miss any dose, you need to report to the procedure list or your anticoagulation or the doctor who manages the warfarin or certain medication. So generally, you should not hold your blood thinner medication before and after the cardioversion, always or always after. If you miss any dose, you should let your doctor know, the surgeon or proceduralist or the anticoagulation, so they had to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other blood thinner medication, Eliquis, Eroto, or Badaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken blood thinner medication such as warfarin, Aliquis, Eroto, or Badaxa? Cardiac cath is the serious surgery, so if you take warfarin and you are stable with your INR history, or if you or if your INR history is stable for a long time, then you should recheck your INR about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You might need to be bridged with a lobanal injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with Lovenox injection, then you need to follow your doctor who managed your warfarin or the anticoagulant. Make sure you understand when to start the Lovenox injection and when to stop right before the procedure and when you can resume the low-venom injection. If your INR result slightly high, you might require to reduce the dose and recheck in 1 week, or reduce reduce the dose and hold for 4 to 5 days prior to the procedure. For the Eliquis Geraldo Adaxa patient, they might need to check the kidney lab, make sure their kidney is normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac surgery. If they have unstable kidney function or chronic kidney disease and their creatinine clearance less than 50, then they may need to hold more than 2 days. If they have to hold for more than 2 days, then they might need to delay resuming the Eliquis Geraldo or Badaxa. So the doctor who managed your Eliquis Geraldo or Badaxa or the anticoagulant will give you specific direction or instruction when to hold your Eliquis Geraldo or Badaxa and when to resume. But you should check with your surgeon or proceduralist to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or proceduralist may delay to resume the platinum medication. Please let me know if you have any question in the comment box below. Thank you. Hello, what should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Geraldo, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You might need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection off warfarin for more than 3 days. If you have a very elevated INR, INR to hold your warfarin, or and reduce the dose of warfarin. Get to the dose and plan to hold for 5 days or so for the procedure. If you have to use the lovinol injection for breaching, then for doctor who both for your doctor who manage your warfarin or the anticoagulant, make sure you understand when to start the lovinol injection and when to stop before the procedure, when to resume the lovinol after the procedure. If you are taking Alaquix, Geroto, or Badaxa, you probably need to check your if not within 3 months. Your Alaquix, Geroto, Badaxa might need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Geroto, or Badaxa on 2 days. When you need to hold your Eliquis, Geroto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically, you resume Eliquis, Geroto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Eliquis, Geroto, or Badaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis, Geroto, or Badaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your platinum medication. If your surgeon or proceduralist recommend to delay to resume your platinum medication, you should report that to your doctor who managed your platinum medication or your anticoagulant so they can update a recommendation in the systems. If you have any question, concern, please let me know in the comment below. what should you do prior to a dental caps procedure to hold by your doctor who managed your platinum patient or acquaintance? If you are taking warfarin and you don't have a stable NR history and you have a critical INR recently, and you might need to check your INR prior to, um, and unless your dental oral surgeon know that uh, you have critical INR recently. If you have any active bleeding, you know to make sure everything's safe. They don't do it else besides the dental caps procedure. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor for platinum medication or the anticoagulation or recommendation. Uh, if you have to hold your warfarin, follow your doctor or the anticoagulant instruction. If you have to hold your Eliquis, Gelato, or Badaxa, then I need 1 day prior to it. Again, you need to discuss your doctor any recommendation. Or oh, if you have to hold your warfarin or Eliquis, Gelato, or Badaxa, you need to check dental see when you platinum. If they don't have any instruction, why they when you need to read, then you need to consult with your doctor, manage your platinum patient or your instruction. You have no active bleed. They might ask you to resume your platinum medication same day after the prior. So prior to a day, you don't have to hold for platinum medication unless otherwise as instructed. Check your INI if needed. Critical INI recently, your INI history not stable. Um, you have active. You should let your dental, your healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that track for platinum medication. Okay, if you have any further question, concern, please let know in those. For the dental cleaning procedure, what you need to do prior to dental cleaning procedure if you are taking platinum medication like warfarin, Eliquis, Roto, Badaxa. So I would recommend that you should not hold platinum medication for routine dental cleaning. Um, if your iron if you're taking warfarin, you need to make sure you are stable with your iron level. You don't have critical iron before routine cleaning. If you have critical iron, probably you need to hold your warfarin for a few days order to get your INA to the therapeutic level. So avoid your routine cleaning if you just have the critical INA, like over 5, or your INA over 6, or you have any kind of active bleeding with over or platinum medication. For the deep cleaning, uh, if you have to have a deep cleaning in on the platinum medication, I consider to hold your warfarin. You need to check with your doctor who manage your platinum medication. Um, they have to review your INA history, and then they will give you some recommendation based on your warfarin and your INA history. Generally, if you have a stable INA history, then you know, and then your current INA is therapeutic, and they might recommend that you hold for 1 day prior to the procedure. Um, if your INA, you know, if your INA is not stable and has a history of elevated INA, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your INA prior to the procedure, usually within 24 hours of the procedure. Um, and then if you are taking the Eliquis, Geralto, Abadaxa, and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day, right, to deep cleaning. And again, if your dentist they are not concerned about your bleeding, then they don't recommend you have to hold your platinum medication. Then you should not hold your platinum medication if you don't have any concern about bleeding. If you are uh, stable with your warfarin doses, and then you have a good history of your INR therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay. If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding or if you don't have any instruction from your dental when to resume your warfarin, then uh, you know your uh, doctor who manage your warfarin might um, have you to resume your warfarin day uh, after the procedure. But you need to double check so you are safe. All right. So any further question or any concern prior to dental procedure, what you need to do when you are taking the platinum medication? Please let me know the comment below. Thank you. Goodbye. Hey, prior to a dental crowns procedure, what should you do if you are on platinum medication? It's warfarin, Eliquis, Geroto, Badaxa. Um, I would recommend should not hold any platinum medication prior to this procedure. Otherwise, as instructed by your doctor who manage your warfarin or platinum medication or typhoid, you should check your INA warfarin if you have a critical INA recently, if your INA history not stable, um, you have active bleeding like blood in urine, stool, uh, cough up with blood, uh, stomach bleeding, nose bleeding, things like that, then you need to let your dentist, dental know that you have some concern with your bleeding. Excuse me. And then um, you might need to make sure your INA not too high prior to avoid any major bleeding. Um, sometimes your dental may find something that may want to do additional procedure, then uh, will cause a problem if they're not aware of you know, critical INA or actively that. If they want you to hold your open prior to dental crowns procedure, then you need to discuss with your doctor who manage your warfarin or other blood thinner medication, or you need to discuss with anticoagulant or you have the instruction safe. And then if they want you to hold your Eliquis, Xarelto, or Badaxa prior to the procedure, for this procedure, you may need to only hold your blood thinner medication for a day prior to the procedure. Again, you need to talk to then your doctor who manage your Eliquis, Xarelto, or Badaxa, or talk to your anticoagulant for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction or any recommendation, then you need to discuss with your doctor who makes blood thinner medication or the anticoagulant. Um, Generally, if you don't have any bleeding after the procedure, right, resume your blood thinner medication on the same day or a day after the procedure. If you have any question, any further question, then let me know in the comment below. Right to the dental extraction procedure, if you are taking anticoagulant like warfarin, Eliquis, or Xarelto, you should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any Latin medication. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially uh, the higher your upper range. You should check your eye now prior to procedure to avoid. So um, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the dentist or oral surgeon. You see what they expect. Some dentists, they may tell you they want INA between 2 and 3, or they want INA less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that uh, your INA expect to be at certain level prior to the procedure. Usually,
they want your INA on the day or 20 within 24 hours, right? Procedure. Uh, um, not stable or higher than the upper range, like a week or 2 weeks prior to the procedure, then um, your doctor may recommend that you should hold your warfarin to make sure uh, you get or you achieve the INR goal. Expect to be uh, within 24 hours. So, for example, if your INR like 3.5, 2 weeks prior to the procedure, right? So, um, I would recommend, you need to hold your warfarin uh, 1, 2 days prior to the procedure, and then you need to retouch the INR the day of procedure. So, to make sure your INR at 2.3, I mean 2 to 3, that what your dentist want. If your dentist want your INR less than 2 prior to the procedure, then you might need to hold for 3 days. If your INR, uh, you know, were 3.5, 2 weeks prior to the procedure, then you need to hold like 3 days uh, prior to the procedure to make sure your INR less than 2. So it still depends on what your dentist want or expect your INR level or goal before the procedure. If you have to hold your INR, I mean, hold your warfarin for 5 days prior to the procedure, okay? Um, Sometimes they have difficult or multiple to extraction. Um, they may want you to hold for 5 days prior to the procedure. They want the INR level less than 1.5. Then you need to hold your warfarin might be for 5 days or more, and on your INR level. So you have to follow your doctor closely to make sure uh, you don't have any help needed. So if you have to hold your warfarin for 5 days to get the INR uh, at less than 1.5, then you may need to be breached with the lower knob injection or enoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to breach with the lower knob injection, then there is a instruction, when to start the lower knob and when to resume lower knob injection. You have to follow the doctor who manage the doctor who manage your warfarin. Um, if you take Eliquid, Yeroto, or Badaxa, it's easier than it prior to the procedure. Um, Generally, for a simple extraction, you don't have to hold Eliquid, Yeroto, or Badaxa. But for multiple tooth extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe. It's safe for certain patients. Um, they are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, um, you know, the surgeon or the proceduralist might need to consider the risk and benefits of
holding the blood thinner medication. So that's a very complicated patient. You need to work closely. They may need to be uh, stay at the hospital uh, before the procedure to make sure they are safe, or stay uh, after the procedure for a couple of days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the aliquid Yeroto, but that's then uh, resume your platinum medication like instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if a simple extraction or multiple tool extraction. Right? If simple extraction, you may not need to hold your platinum medication. If multiple tooth extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your I9 level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or uh, stroke. And if you take an Aliquid, Yeroto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then uh, you should resume your blood thinner medication as instructed by your uh, dental. And if you have to be briefed with love enough injection, then you have to follow uh, your doctor who manage your warfarin to make sure what day you need to start the Lovenox and what day and when you resume your Lovenox and when to start the Lovenox injection. All right. If you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on blood thinner medication, such as warfarin, Aliquid, Xarelto, or Badaxa? You don't have to hold your blood thinner medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who manage your warfarin or your anticoagulation or um, your dental or your oral surgeon. Okay. Um, if you have a unstable, you have an unstable INR history, then you may consider to reject your INR. If you have a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do, uh, they need to postpone the procedure, this procedure, because you have bleeding, you are not too high. But if you need to talk to them to make sure that they don't do anything else besides the fillings, they require you to hold your warfarin, and you need to follow your doctor who manage the blood thinner medication or the anticoagulate. And um, if they require you, if you're taking the Aliquix, Xarelto, or Bedexa, and they require you to hold your platinum medication the whole day prior to the procedure, have to hold. And then if you have to hold your platinum medication, then you could resume your platinum medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manage your platinum medication or the anticoagulant, the when you should resume platinum medication. If you don't have any higher bleeding after the procedure, then might resume your platinum medication the day after the, or even uh, 10, 10 day of the procedure, you have no bleeding. So, all right, so again, before a dental fillings procedure, you don't have to hold any platinum medication. That's otherwise that's instructed. And then you don't have any stable INR history, critical INR recently, then take your INR to have any kind of bleeding risk uh, procedure. Um, and I just say for the fillings, you should not worry about INR history or kind of bleeding, because they have live threatening bleeding, probably not do anything. They have to hospitalize if they have also agent push your bleeding back to normal. All right, if you have any further question or concern prior to a dental procedure, please let me know in the comment below. Thank you. Before a dental root canal procedure, what should you do if you are on platinum medication, such as warfarin, Aliquix, Xarelto, Bedexa? Um, I would recommend you should not hold your platinum medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have unstable INR history, uh, your uh, recent INR was critical, too high, then you should check your INR prior to the procedure to make sure you are safe from the procedure. Um, if your INR is therapeutic or you have history of stable INR, good INR history, then you don't have to hold your orphan prior to, unless otherwise as instructed by your um, doctor who manage your orphan or the anticoagulant. Or if your dental or your oral surgeon recommend that you should hold your platinum medication, then you need to discuss with your um, doctor who manage your warfarin or the anticoagulant to make sure that you hold your platinum medication appropriately. So if you have unstable INR history or your INR was critical recently, you should check your INR, make sure you are safe. Um, and if you have any active bleeding, should
unless your doctor or your anticoag clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine, you let your doctor and your dentist, your oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your aliquid, your atovadexa. So if you require to hold your warfarin, it work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the iron level they want before a procedure. And then if you require to hold your aliquid, your or Badexa, then I would recommend you should go for 1 day prior to the procedure. And if you have to hold your warfarin or your aliquid, your or Badexa, then you need to resume your blood thinner medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manage your warfarin or your anticoagulant to see if they have any recommendation. If you have any further question or concern prior to a dental root canal procedure, please let me know in the comment below. Prior to dental scaling procedure, so what should you do when you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, Adaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manage your warfarin or your community clinic who manage your warfarin. Or your clinic who manage Aliquis, Geronto, or Badaxa. If you are taking warfarin and you have unstable iron history, then you need to check your iron to make sure you are not critical prior to a procedure. So if you have a critical iron, you should hold your warfarin until your iron back to the therapeutic level or uh, below your range to be safe for the procedure. Um, if you are uh, stable with your warfarin and you have a good iron history in range for a long time, then you may not hold your platinum and your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your blood thinner medication prior to dental scaling procedure. If you have to hold your blood thinner medication prior to the procedure, as instructed by your dental, then you need to resume your blood thinner medication instructed. Make sure uh, have a bleeding can control your blood clot, prevent stroke if you don't. Now, if you take too long to boom for blood thinner medication, so that's one way you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure
let them know that you are on platinum medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anti-coag clinics, make sure they have a recommendation, save uh, the procedure. Again, um, I would not recommend take platinum medication before a dental scaling procedure unless otherwise as instructed by your dental. Um, if you are not stable with your warfarin doses, you have unstable INA history, and uh, have the critical INA recently, then you should um, talk to your doctor or your anti-coag clinic. Uh, make sure that they give you good instruction what to do with your platinum medication prior to the procedure. And then after the procedure, you resume your platinum medication as instructed by your dental. Um, if you don't have any instruction, if they don't know what to recommend, then you should follow your doctor or your anti-coag clinic recommendation. Safe. Resume your platinum medication appropriately. If you have any further question or concern about uh, before dental scaling procedure, what you do when you are on platinum medication. Thank you. Prior to a total knee replacement surgery, so what should you do if you are on platinum medication? If you are taking warfarin, then your doctor who manage warfarin or the formulary clinic, they might reject your INA about 2 weeks prior to the procedure. Um, Depending your INA result or your INA history, then if it's too high, then they adjust your warfarin dose, then have you to come back in 1 week. And then if you are getting better or get into the range, then they may hold for often for 4 to 5 days prior to the procedure. And if you have a history of recurrent iron, recurrent blood clot or recurrent stroke, then they might need to bridge you with the low injection. Okay? So when they have to bridge you with the low injection, they need to make sure you have up 2 days kidney labs, the, within 3 months of your kidney lab, uh, and then your current weight in order to dose Lovenox. So there are some instructions regarding when to start your Lovenox injection and when to resume your injection. You need to follow doctor or typhoid. Make sure take you bridge the Lovenox injection correctly. And then if you take automatic, um, your doctor, excuse me, your doctor who manage your platinum medication or the anticoagulant might check your kidney function. Um, they need to update the labs as needed, usually within 3 months, and your labs is okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. Um, if you have a normal kidney function, then probably you should need to hold for like 2 days prior to your total replacement surgery. Um, if your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your create screening clearance, and they will recommend that you might need to hold more than 2 days. If you have bad kidney function, then you might go 3 days off depend on your function. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your yellow turbidixa for 2 days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your blood thinner medication. You know, generally, for warfarin, you may resume your warfarin a day after procedure if okay with surgeon. And then for the Aliquid, yellow turbidixa, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid Yeroto Obadexa maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulation who manage your blood thinner medication and your surgeon or a proceduralist. If you have any further question or concern, let me know in the comment below.
Hello, Yangting. This is a very good question. A lot of people ask me this question when I handle manage the community clinic. Yes, some people have to take both warfarin and aspirin. But not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet or certain people, certain patients have the AFib, but they don't have additional factors. So they only need take aspirin. But when they have additional factors like over over 75 or have diabetes. So generally the CAT2 score over 2, they should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year or so. Some people have to take the other antiplatelet, like Plavix. So, depending on your medical history, your doctor or your pharmacist will reveal whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further question? Please let me know. Thank you. I am Tim. Uh, this is another good question. I think uh, generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days, but uh, you need to check with the heart doctor to make sure they are okay for that. Hello, Yati. This is a good question. What is the difference between Motrin and Tylenol? Uh, I say Motrin is a non-inflammatory steroid um, drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas Tylenol is used for non-inflammation and like my headache or my fever or my back pain. But just pay attention on all the side effects for each of these medications so you prove. So, Motrin may affect your stomach like ulceration when you use very high dose or you take it in empty stomach. So, and then it might affect your kidney also. So, when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. Um, and Tylenol is may affect your liver. So you should not exceed 4,000 milligrams of Tylenol um, for any circumstance. So generally, you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligrams a day. May affect your liver, especially if you have any liver disease. You should consider heavily um, when you take in Tylenol. Um, and when you know, drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. So those this is very important to consider when you should take Tylenol or Motrin. That's pretty much what is different between Tylenol and Motrin. If you have any further questions, please comment below. Let me. Thank you. Hi, Brent. Pam. It's a good question. Basically, this is a general question I used to have. Uh, Typically, as you know, we should not take Motrin while we are on warfarin because Motrin um, is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant, such as warfarin, or Eliquis, Yeroto, um, any type of anticoagulant. Uh, we should not take Motrin. So if you are not allergic, not allergic to um, Tylenol, you should take Tylenol instead of Motrin.
All right, so next medication is warfarin, Coumadin. So when you should not take warfarin, you should not take warfarin if not recommended by your doctor or or pharmacist. Okay, um, if there is no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, uh, pure fibrillation, or AFib, uh, this is a very clear indication. Warfarin. You should not take any active bleed, any warfarin if you are, or if you have any active bleed, like stomach bleeding, nose, or blood in urine. Did not uh, start warfarin if you have active or significant or major bleeding. Um, you should discuss with your doctor or your pharmacist to make sure they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you let your doctor and your pharmacist to have active bleeding or you have a history of major bleeding, the warfarin. And if you have been taking warfarin and you should have the active bleeding, that you need to report to the doctor. Make sure they stop it. And if you have life-threatening bleeding, then you need to stop warfarin right away and go to emergency for further evaluation. And you should not taking warfarin with other blood thinner medication like Eliquis, Yeroto, Redaxa. If they uh, blood thinner medication, you should applicated medication. If you about switching from warfarin to Eliquis or switching from the other blood thinner medication to warfarin, then you know there may be some overlap for a few days. For example, if you switching uh, from uh, Eliquis, warfarin, then you need to overlap the Eliquis and warfarin for 3 days, or you stop the Eliquis to make sure warfarin start working in your body after 3 days, like that. But not taken together in a daily basis. So your to prevent your blood clot or stroke. And when you on warfarin, or you are new to warfarin and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue on the antiplatelet like Plavix or aspirin. You need to check to make sure uh, you still need to take Plavix or aspirin. And if you have been taking and if you've been taking warfarin and they just start a Plavix or aspirin, then you need to let them know you're on warfarin to make sure uh, you know the Plavix or aspirin they want to start still need it. Sometimes it's not. And sometimes they don't know if you are on warfarin or blood thinner medications. It just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin because they have different indications. Make sure you check with to, to make sure you don't have to take the medication that not take prevent suicide. You should not take warfarin if you're allergic to it. And then one more thing for the warfarin. So typically, you should hold 4 to 5 days prior to the major surgery or procedure, uh, colonoscopy, knee replacement, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, and presuming that, uh, presume that that your INA level is at the therapeutic level. And if your INA level, at the supra-therapeutic or out range, then we'll have hope your INA, hope your warfarin accordingly. Because that is different topic, very complicated. And then, after the procedure, then you ask the surgeon or the proceduralist to make sure that if it's okay to resume the warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend patient to check with the surgeon or the doctor who performed the procedure, make sure when it's okay to resume warfarin. So this is very important information for people who have to take warfarin or who have been on warfarin. And when you should report to your doctor, and when you need to go to the emergency room because of bleeding, side effect, and when you taking the warfarin, then what medication you should avoid. Check with your doctor or pharmacist every time you have a new medication, including over-the-counter herbals, vitamins, uh, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both uh, affect warfarin and affect your body. So, you check with your doctor, and when you have uh, any kind of bleeding, you need to report to the doctor, or even you just have abnormal bruising, you check with your doctor. You might have too much warfarin in your body, and or you might have take or eat any food that increase iron or increase bleeding. Just make sure you report to you. And pay attention, and sometimes they switch you to a new blood thinner medication, Aliquix, Geronto, then I need to stop warfarin when you start the new blood thinner medication like Aliquix. And make sure that uh, you stop the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when taking warfarin or you have to warfarin. Have any further question or want to clarify anything? Please let me. All right, next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just uh, go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain, but you know, yes, you can do that, but if you don't have any additional medical condition, or if you know don't know how much you should take, things like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, it might affect your liver. It take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your pharmacist, because it may uh, affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are, blood thinner medication like warfarin or Aliquid or Daxa, it's okay for you to take Tylenol. It's safe to take compared to all the pain relief medication. Okay, so uh, and then the last one is you should not take Tylenol if you are allergic to it. So the very important information about Tylenol, when and what you should take, and then what you need to pay attention, precaution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the next medication, the fish oil, omega 3. So the omega 3 uh, or fish oil you can buy over the counter, and it's generally safe to take. Um, but I would recommend that you should check with your doctor to make sure you take it correctly. Okay? And I would not recommend that you should take the fish oil if it being expired. Now, you should make sure that it's not expired, so you take the good product. Um, if it's expired, it might cause problems. When it's expired, it's no longer effective like it should, but it increase side effect, like bleeding or cramps or nausea, things like that. It's the main side effect or bad taste, bad smell. It might contain harmful bacteria. When it's expired, it may leaking or broken. You may experience some bacteria. And some research indicate that it may lead to increased risk of cancer expired. So make sure you check the expiration day and take it correctly. Also, uh, you should store the medication in the appropriate location, not too cold, not too hot. Make sure the medication uh, work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cup of blood, or you have uh, after you take fish oil, you have bleeding, or you have any kind of dark or hairy stool, then you may need to stop taking fish oil. And you should not start when you have any active bleeding. That's very important. The fish oil itself might increase risk of bleeding, a cause bleeding. And you should not take fish oil when you uh, taking warfarin and having critical or elevated iron level. If you have iron level about 5 or 6, it might very dangerous when you take fish oil. It increase risk of bleeding. And you should not take the fish oil you taking other blood thinner medication like Aliquid, Eroto, Alexa, or the antiplatelet like aspirin or Plavix have bleeding or low hemoglobin. Those uh, uh, factors very important to consider whether or not you should uh, taking continue taking fish oil or start the fish oil. So if you have any of these factors, need to check with your doctor or your pharmacist to make sure that you don't do any uh, increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligram a day without clear indication. You know, if somebody have some sort of increased cholesterol, then they might take about 2,000 milligram a day. But if you take more than that and you don't have any clear indication or recommendation, then you should not, because there's increased risk of bleeding, or it may have other side effects. So I would recommend that you should check with your doctor if you want to take more than 2,000 of fish oil a day. And do not take fish oil if you're allergic to it. Okay? This is very important information, and not a lot of people know about this. I've been working on anticoagulant for a long time, dealing with this supplement a lot. I recommend you should check with your doctor and your pharmacist if you have any active bleeding or if you need blood thinner medication to make sure you are safe from bleeding. And you should not take this medication when it is being expired. And then when your iron is very high, like critical level or elevated, just stop taking this oil or do not start or take this oil supplement or the cup. All right, if you have any question about this over the counters, this medication, please let me know in the comment. Thank you. All right, next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But yes, you can do that. But if you don't have any additional medical condition, or if you know don't know how much you should take, things like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, it might affect your liver. It take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your pharmacist, because it may uh, affect your liver function. And then do not take more than 4,000 milligram a day. If you do so, it might affect your liver. very important, you know the dose, how much you can take a day on a Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you on, uh, blood thinner medication like warfarin or Aliquid, but actually it's okay for you to take Tylenol. It's safe to take compared to all the pain relief medication. And so, uh, and then the last one is you should not take Tylenol if you're allergic to it. So, the very important information about Tylenol, when and what you should take, and then what you need to pay attention, precaution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the net medication, uh, the Motrin. This is also available over the counters at the pharmacy like CVS, Walmart, or Walgreens. So you can buy over the counter or uh, can get prescription from your doctor. But you should not take Motrin or ibuprofen if it's not recommended by your doctor or pharmacist. And you should not take the Motrin if you are on empty stomach. You don't have any food in stomach. Might cause problem, stomach ulceration or bleeding. So make sure you eat before you take Motrin or ibuprofen. If you have major stomach or kidney problems, you should check with your doctor or pharmacist before you take the Motrin or ibuprofen. So major stomach problem like peptic ulcer or uh, gas- gastric uh, problems or heartburn or GI bleeding or stomach bleeding, blood in urine, or kidney problems. You know, you uh, have the kidney dysfunction or renal problems. Need to make sure you talk to your doctor or pharmacist before you take Motrin or ibuprofen. Hey, so if you are taking warfarin, uh, blood thinner medication like warfarin, Aliquid, Xarelto, or Badaxa, etc., uh, you should not uh, start the Motrin or ibuprofen. If you have, headache or back pain or toothache, things like that, you might try some Tylenol instead of Motrin. Because Motrin may increase the bleeding risk when you are on warfarin or Aliquid or any blood medication. So, and if you um, taking Motrin or ibuprofen, you've been taking Motrin or ibuprofen, then you should talk to your doctor who give you a new blood thinner medication like warfarin or Eliquis or Badaxa. Should let them know you're on the Motrin to avoid any increased bleeding risk. And you should not take Motrin or ibuprofen more than 4,000 milligrams per day. If you take more than that, it might cause uh, very serious side effect like stomach ulceration or bleeding, and it may damage your kidney. So make sure do not take any, uh, do not take more than 4,000 milligrams of Motrin or ibuprofen per day. And you should not take Motrin or ibuprofen if you're allergic to it. This very important information. If you have been taking Motrin or ibuprofen, or if you will take Motrin or ibuprofen, you pay attention to this info. Very, very important. If you don't follow the recommendation from your doctor or pharmacist, you may have problem with medication. Most of people have stomach ulceration that they didn't take the medication correctly. They take on their empty stomach that easily cause stomach ulceration. And it may damage your kidney. You take too much Motrin, like overdose of, or more than 4,000 milligram a day. And you may have some kind of bleeding, maybe gastric bleeding, when you take with warfarin or Aliquis or any other blood thinner medication. All right, so this, excuse me, this is very important information. I hope that you um, should pay attention of this information before start or uh, stop the medication. The Motrin you may take as needed. You don't have to take it every day. Just take it as needed for your pain. And this is the non-formulary steroid medication. The non-steroid inflammatory medication, NSAID, they call NSAID. Uh, Usually, a Motrin they take something for your swelling pain. When you get your toothache and you have swelling gum, or you have back pain because the swelling or inflammation of your back, commercial strength, things like that, Motrin may help a lot compared to, I don't know, if you are taking a blood thinner medication, then you should avoid Motrin, increased bleeding, and it may affect your kidney function. All right, thank you. Okay, so do not take aspirin if, for one, not recommended by your doctor or pharmacist. So for this medication, uh, it has some serious side effects. So you should not take it if it's not recommended by your doctor. Number two, if there's no clear indication, for example, a clear indication including, take aspirin for your heart, for your atrial fibrillation, or for stent, protect the blood clot due to the stent insertion. Excuse me. So I would recommend that you should check to see if you have any clear indication for your expert. Number three, do not take aspirin if you have any active bleeding, like GI bleed or stomach bleed, nose bleed, or blood in the urine. So any active bleeding should you may need to hold your aspirin. And of course, talk to your doctor or your pharmacist uh, if they have any further recommendation. You know, if you are taking anticoagulant like warfarin, Aliquid, or Xarelto, you need to make sure that if you have to take the aspirin, usually the baby aspirin, while you on the warfarin or Aliquid or any type of anticoagulant, or even the antiplatelet like Plavix. So these medication have the coagulation effect. So make sure you check with your doctor or pharmacist to make sure um, if you are required to take aspirin while you're on the blood thinner medication or not. Or if you are taking the baby aspirin or the regular dose aspirin, the 325 milligram aspirin, then you need to talk to the doctor who give you a new blood thinner medication, um, like warfarin or Aliquid. Talk to them to see if you have to continue the aspirin while they start you new blood thinner medication, warfarin. And do not take aspirin if you're allergic to it. May have some kind of bad reaction. Uh, it's very dangerous. You're allergic to aspirin. So these are very important information for you as a patient to know that um, why you should not take the aspirin or why you should not continue to take aspirin uh, when you have a new medication such as new blood thinner medication like warfarin, Aliquid, or Bedaxa, or Plavix. All right. So, any question, concern about this topic? Please let me know. Thank you.